So today we will discuss a corneal ectasia, that is keratoconus. So it is a progressive disorder in which the cornea assumes an irregular conical shape, and the hallmark of the disease is there is central or paracentral thinning of the cornea at the level of the stroma, which results in conical shape and protrusion of the cornea. So it presents in the puberty. Patient usually complains of frequent change of glasses, and mostly both eyes are affected, but the presentation is usually asymmetrical, and you will get an irregular astigmatism in such patients. So there are three grades: mild, moderate and severe. If the steep SIMK values are less than 48 diopter, it is a mild keratoconus. But if the steep SIMK values are between 48 to 54 diopter, then it is a moderate, and more than 54 diopter, it is a severe keratoconus. So with the help of distant direct ophthalmoscopy, we get an oil droplet reflex, and with the help of retinoscopy, we get a scissor reflex in such patients. And when we see such patients on slit lamp examination, then deep vertical stress lines are present at the level of the stroma, and those are called water striae. Prominent corneal nerves are also present, and Fleischer ring is present in moderate to severe cases. And when we throw a light on the temporal cornea, we will have a nasal arrow cone on the nasal part of the cornea, and a cone will be appear, which is known as a Rizzuti sign. And in severe cases, when patient will look in the downward gaze, they will have a Munson sign positive. And in some cases, there is sudden painful rupture of the descent membrane, which results in the imbibition of the water in the anterior layers of the cornea, and that is known as acute hydrops. It is a very painful condition, and it is an emergency, and it should be treated aggressively. So there are certain ocular and systemic associations: vernal keratoconjunctivitis, blue sclera, aniridia, Leber congenital amaurosis, retinitis pigmentosa, persistent eye rubbing, and floppy eyelid syndrome are some of the ocular associations of keratoconus. Apert syndrome, Down syndrome, Ehlers-Danlos syndrome, Marfan syndrome, and osteogenesis imperfecta. I will not go in the detail of these syndromes, but in such patients, keratoconus have been found. So we have to investigate such patients. Previously, a placido disc was used to see the irregular corneal rings, but now steep SIMK values and K readings are seen on the keratometry, and the latest treatment choice of investigation is corneal topography. So we will give a separate talk on the interpretation of corneal topography. So now the latest treatment is corneal collagen cross linkage, in which riboflavin eye drops are put on the cornea for about 30 minutes, and then the eye is exposed to ultraviolet A light radiations in the mild to moderate cases. But in the such cases in which there is a high astigmatism, we can use rigid contact lenses. And nowadays a latest treatment has been introduced, which is bone membrane transplantation, which is commonly being performed to treat the moderate cases of keratoconus. Intracorneal ring segment implantation, or INTEX, is used for moderate cases and in patients which are above 25 years of age. But in severe cases, we have to go for keratoplasty. So if you have any questions or queries, you can put on the comments and you will get the answers. With this, I thank you all.